So when you are preparing a vegetable dish, make sure you give some spices because raw vegetable is not very tasty, neither there is no aroma in it for majority of the part. So this is the vegetable medley. Um, Carrots, tender stem broccoli and baby corn. And I put olive oil and I put a little bit of chipotle paste and a little bit of ginger paste. Sometimes I do put garlic paste as well. And you put olive oil. So this is olive oil, although it says goose fat. It's not goose fat. And yeah, that's it. And then you parboil it with boiling water for 2 minutes so that it becomes a bit soggy but not too soggy. It has to be crunchy when you're eating it. And the other thing is that you must chew it. If you've seen the cow, how they chew the vegetables or grass, they chew it to almost a liquid slurry. Because a lot of my patients, they turn up to A&E with abdominal pain and loose motion because this will form a clump and this will get stuck in the corners of the large bowel. There's a corner under the rib cage on the right hand side near the liver, and then there is another corner at the very end of the very bottom of the pelvis in the west, and then there's another corner near the spleen again on the top of the abdomen, like diaphragm. And some patients actually feel like they're having a heart attack because the whole abdomen is distended. They're kind of uncomfortable. They don't feel like they want to eat because it's bloated and all that. Because now this is fermenting. Depending on what kind of vegetable you are eating, some vegetables will ferment more than others. These are called FODMAP food, FODMAP. And there is the biggest kink or narrowing bend is at the very end of this letter M. Is called the sigmoid kink, I call pigtail, and then the rectum. So these are the kinks that these will get stuck. So unless, yes, it is good that vegetable is extremely beneficial. It should be variety, not just 3 vegetables every single day. And it should be sufficient amount, not too much. Then you will get bloatedness, and all the stuff. Not too little, okay? And you have to chew it so much that it is almost liquid. And majority of the vegetable, you should be softening it up with parboiling or a little bit of frying, like a flash fry, meaning very high temperature, little oil, and very quickly saute it. It just enhances the taste. So that's it. So chew. Today's message is chew because you're not chewing very well and it is forming a clump and is blocking all the points. And then some of the patients are coming to A&E with abdominal pain. They're getting a CT scan under the surgeon and the CT scan is revealing little bit of inflammation above the blockage. And then people are by mistake telling them that you have got colitis and starting them on colitis medicine. And when it's a colitis, yes, there is colitis because there is inflammation you can see on the radiology. But I call this like a false colitis. You can call this cramping colitis because whenever there is a blockage, there is cramping. And whenever there is a cramping, there is lining of the lining of the intestine, we call mucosa, will get inflamed. But the moment the blockage is gone, within 48 hours, this lining will become easy. And if you repeat a CT scan, it will be normal within few weeks, probably, sometime even days. But you don't want to do that. So I will flush the bowel, get rid of all the stuff, blockage, and very soon they can leave the hospital. But unfortunately, most of the doctors, despite not seeing anything urgent, acute on the CT scan, they start morphine for the pain because patients are in pain and we are kind. We don't want patient to suffer. And what morphine does, it paralyzes the bowel, causing the problem even worse. Okay, and then the patient goes round in cycles. I've seen it many times. Patients coming to A&E emergency for 3 times, 4 times, exactly same thing repeats. Tummy pain, loose motion, suffering with change in bowel habit for a few days, sometimes a little bit of bleeding from the back passage. They get a CT scan, they get a little bit of colitis, they get started on steroid unnecessarily, and antibiotic unnecessarily, although I will give antibiotic if your CRP is high, like infection markers are high. And then they never get told about the food and the blockage and all the stuff. They go home. Sometimes they feel that they're pushed out of the hospital even before they're ready. And within one of my patients, I think, was coming back every week or other week. Everything happened like clockwork, exactly same, until the daughter puts in a big complaints. So This is so common. I wanted to do an audit of these cases, like how much we are not treating the patient properly and giving the advice properly, leading to the increased length of stay in the hospital and unnecessary suffering. You can prevent this just with this and telling the patient what is actually happening. And when they're feeling it is bloating up their tummy, they're changing their bowel to more loose, more crampy, just take a dump, flush everything out. Unfortunately, this is not something that you will see in the guidelines, but this is what helps the patient. This is what helps the patient and general population. We are eating less veg, but when we are eating, we are not chewing. And we Indians, we will not taste anything, even if it's healthy, unless it is really nice. It's really nice. Just come and taste it. Have a nice day. Monday, a lot of Indians, Hindus particularly, they will go vegetarian. Just one day, control your willpower, control your greedy tongue, control your hyperpalatable food and go veggie. Just one day a week.